All right, let's talk about mastering the health and physical assessment. My goal here is to break this down for you, piece by piece, so you can walk into your nursing exam feeling totally confident.
So, here's our game plan. First, we're going to build the foundation. Then we'll get into how to gather the patient's story. After that, it's all about the 4 core techniques of the physical exam. Then we'll put it all together in a head-to-toe assessment, and finally, wrap it up with how to document everything like a pro.
Okay, first things first, setting the stage. I want you to think of yourself as a clinical detective. A great investigation doesn't just start when you find the first clue. It starts with securing the scene. The same is true for a patient assessment. It's all about creating the right environment. Now, let's talk about the why behind these steps. This isn't just about being polite. When you ensure privacy and sit at eye level, you're breaking down barriers. You're building trust. And when a patient trusts you and feels safe, they give you the real story. That's the key that unlocks everything else.
Okay, the stage is set. Now it's time to get the witness statement. In our world, we call this subjective data. This is the patient's story in their own words. And believe me, this narrative is what's going to guide your entire investigation.
So this is where you really put on your detective hat. You have to listen, really listen, for all the little clues, the details, the timing. The story they tell you gives context to all the physical evidence you're about to uncover. Without the story, your findings are just a random collection of facts.
And to get that story organized, you need a system. This right here is your framework. You start with the chief complaint, literally their own words and quotes. Then you dig deeper. You build out the history of this illness, you look for patterns in the family, and you consider social factors. Every piece helps you connect the dots.
Now listen up, because this is a huge exam alert. You absolutely have to know OLDCARTS. This isn't just a checklist to memorize, it's your power tool for digging into any symptom. It turns a vague complaint like, "I have a headache," into a detailed story that starts pointing you toward a real diagnosis.
All right, you've got the story. Now it's time to find the physical evidence. We call this objective data. This is the stuff you can see, hear, feel, and measure for yourself.
So here they are, your 4 main techniques. And you have to pay attention here because the order is absolutely critical. You always start with inspection. Just looking, get a baseline before you touch anything. Then you move on to palpation, or touch, then percussion, which is tapping, and finally auscultation, or listening. For almost the entire body, this is the sequence.
But you know there's going to be a trick question on the exam, right? Is that order, inspect, palpate, percuss, auscultate, always the right way to go? The answer is a big fat no, and you have to know the exception.
And here it is. This is your high-yield exam tip. When you're assessing the abdomen, you inspect, then you auscultate, then you do percussion and palpation. So why the switch? Well, think about it. If you start pushing and tapping on the belly, you're going to stir things up. You'll create bowel sounds that weren't there before. You'll have tampered with the evidence, so you have to listen first.
Okay, now let's put it all together. The head-to-toe assessment is where you apply these 4 techniques systematically, system by system. Let's hit some of the absolute must-knows for your exam.
Let's start with the skin. For your exam, the ABCDE mnemonic is non-negotiable. You have to know it. This is your quick and dirty screening tool for suspicious moles or lesions that could be melanoma. Asymmetry, border, color, diameter, and evolving. It's a fast way to spot the big warning signs.
Okay, checking for pitting edema. This is so important. This isn't just swollen ankles. This is a major clue that your patient might have fluid overload, which could point to some serious stuff like heart failure or kidney problems. You'll press down and then grade it from 1+ to 4+ based on how deep the pit is and how long it sticks around. It tells you just how severe the problem is.
Moving on up to the eyes. The eyes are a fantastic window into the neurological system. And if you want to chart that a patient's pupils are normal, there is one acronym you have to know: PERLA. Let's break this down because every letter here is a specific check. Pupils equal and round, that's your baseline. Reactive to light is a direct test of key cranial nerves. And accommodation checks if the eyes can properly focus from far to near. If anything's off here, it's a huge neurological red flag.
Another huge eye exam is checking the 6 cardinal positions of gaze. You're not just watching their eyes move for fun. When you have your patient follow your finger in that H pattern, you are literally taking cranial nerves 3, 4, and 6 for a test drive. Any weakness or jerky movements can point you to a specific neurological problem.
Now, let's talk about the lungs. You can't just put your stethoscope anywhere and hope for the best. You have to use these specific landmarks, and you have to do it in a systematic ladder pattern. But here's the most important part. You listen to one spot on the left, then you immediately listen to the exact same spot on the right. That side-by-side comparison is how you spot trouble. And what are you listening for? This table right here is pure exam gold. You have to know the difference between these sounds. Crackles can mean fluid in the lungs, like with pneumonia. Wheezes mean narrowed airways, like in asthma. Being able to tell them apart is a fundamental nursing skill. All right, on to the heart. Just like the lungs, you have to know your landmarks. These 5 spots are where you can best hear the sounds from each specific heart valve. And to remember the order, just use this mnemonic. All people enjoy Time magazine. Aortic, pulmonic, Erb's point, tricuspid, mitral. Easy.
Now, if you hear a whooshing sound that's a murmur, you have to grade how loud it is. This is the standard scale. But here is the key takeaway for your exam. Grade 4. A grade 4 murmur is the first time you can actually feel the vibration on the patient's chest. And that vibration has a name. It's called a thrill.
We're on the home stretch. You've done this amazing assessment, but it doesn't count for anything if you don't document it properly. So, it's time to file the final report.
The SOAP note is how we do it. It's such a beautifully logical way to organize all your findings. You start with S, the subjective story the patient told you. Then O, the objective evidence you found. Based on that, you make your A, your assessment or diagnosis. And finally, you create P, the plan. It's the perfect conclusion to your investigation.
So, what's the big takeaway from all this? A health assessment is not just a checklist of tasks you have to get through. It's a thinking process. You are a detective. You gather clues, both from the patient's story and your own exam. You analyze the evidence, and then you use all of it to build a strong case for how to best care for your patient. And that right there is the art and science of nursing.